All right, welcome back to ABA exam review and the continuation of our BCBA practice question series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, well, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, please let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A teacher wants to determine which classroom activity is most reinforcing for a student. They provide unrestricted access to various activities, such as reading, drawing, and playing with toys, and observe the amount of time the student voluntarily spends on each activity without providing guidance. What type of assessment is being conducted? So we have an assessment question, and let's try to determine what are we trying to assess. Well, the teacher wants to know what activity is most reinforcing for a student. Now, if they're trying to figure out what's most reinforcing, then typically they'd be doing a reinforcer assessment. However, in this case, what is the teacher doing? They're giving unrestricted access to stimuli, reading, drawing, toys. All they're doing is observing the amount of time the student spends on each activity without providing guidance. So this isn't a true reinforcer assessment. They're not manipulating things in a way to figure out how the consequence or the stimulus is changing behavior. They're simply seeing what is the learner engaging with. So this is much more similar to a preference assessment. Now, we have to ask ourselves, what type of preference assessment is this? If we look at a paired choice preference assessment is typically or will be two at a time, right? Two stimuli at a time. In this case, this student can access all kinds of activities all at once. Can't be paired choice. Can it be B, free operant? Free operant means more or less things are led by the learner. We're not giving a lot of instruction. We're not giving a lot of guidance. We're just letting the learner be. And this is exactly what's happening here. The learner is engaging with these different stimuli without much guidance. What about C, multiple stimulus preference assessment? We are assessing multiple stimuli here, right? But a multiple stimulus preference assessment is very systematic. We're either doing a with or without replacement assessment where we're controlling everything. In this case, this is learner-led. It's much more free operant. And then D, single stimulus preference assessment, is going to be one stimuli at a time. We know it can't be the case here because there is unrestricted access to all these different activities and stimuli. So in this case, it must be free operant. And the key here is we've got all these unrestricted activities, plus we're not giving much guidance. A behavior analyst begins working with the new client who has a history of challenging behavior in classroom settings. Before designing an intervention, the analyst reviews the client's individualized education plan, recent medical evaluations, and notes from previous ABA sessions to gather information about the client's needs and history. Why is it critical for the behavior analyst to review these records? So a key part before we start any new client, before we start assessment, is we have to review records. This includes things like IEPs, medical records. We're not doctors, right? But it might give us insight into maybe prior medication usage or effects of medication. And of course, any prior ABA sessions that have occurred. We can also look at things like speech and occupational therapy. Whatever might guide us and give us information about the client, we want to review. And that's what the question is asking. Why is it critical to review these records? Because the analyst does this with a brand new client with a history of challenging behavior in the classroom. A, to gather indirect data about prior interventions and outcomes before assessment takes place. A sounds good, right? It is indirect data because we're not directly observing anything. We are gathering information about interventions and outcomes before our assessment. Does this mean we're going to copy word for word what a prior ABA practitioner did? Of course not, right? But it's going to give us an idea, maybe, of what worked and what didn't work and what was being done before. What about B, to avoid spending too much time conducting new assessments? Well, it's a new client. It's our new client. We have to conduct new assessments. We're not trying to avoid assessments. This is guiding our assessment. C, to ensure that interventions are consistent with insurance requirements. This is not much of an insurance thing, right? This is a pre-assessment information gathering exercise. And then D, to minimize overlap between the education plan and the new interventions. If anything, we want to use the knowledge we gain from the individual education plan to maybe tailor our own treatment plans. We want everything to be collaborative. We want things to make sense in the context of one another. If they're working on something with the education plan and we have the opportunity to work on it as an ABA practitioner, we want to do that. So D is the opposite of what we're looking to do. So the best answer here is A. We're going to gather indirect data about prior interventions and outcomes before assessment takes place. A behavior analyst supervising a team of behavior technicians notices a decline in the accurate implementation of behavior plans. To address the issue, the analyst provides targeted training and feedback. After 2 weeks, the analyst reviews session integrity data, which indicate an improvement in implementation. What is the most critical next step to evaluate the effectiveness of the supervisory practices? As a BCBA or BCABA or behavior analyst in a supervisor role, one of your primary jobs is technician management, right? Staff management, staff supervision. And we want to make sure our supervisory practices are conceptually systematic and driven by data. So we need to constantly evaluate how are our practices. In this case, you have a behavior analyst who notices a decline in implementation from her technicians. What do? They provide targeted training and feedback, which is great. 2 weeks later, they review integrity data and they see an improvement. So all that's fantastic, right? They made a change, or they noticed a problem, they made a change, they implemented training and feedback, they evaluated the effectiveness. What's next now? We've gone after 2 weeks, we've looked at it once. What do we do now? A, gather feedback from stakeholders about the technician's performance. That is not the most critical next step. Should you consult with stakeholders about how technicians are doing? Of course, but you've got to take that with a grain of salt. That's going to be very anecdotal. B, continue monitoring session integrity data to ensure improvements are maintained. Absolutely. Our job's not done, right? We don't just measure one time and say, all right, that's it. We need to continue monitoring the situation to make sure that the technicians are not reverting back to old habits. C, focus exclusively on training new technicians to prevent future issues like this. You can take the training and apply it to new technicians, but to focus exclusively on new technicians is not the right idea. No matter how long a technician has been employed or how much experience they have, you still need to provide supervision. D, assume the improvements will continue and shift focus to a different task. Worst thing we can ever do in ABA, right, is assume anything. It is not how we conduct ourselves, right? We don't assume. We look at data, we measure, and then we make decisions. In this case, the most critical next step to evaluate the effectiveness of supervisory practices is B, continue monitoring session integrity data to ensure improvements are maintained. Luke is trying to determine the best possible reinforcement schedule for his current client. As of now, the client is told to work for 15 minutes. After 15 minutes, the client receives a 5-minute break and then works 15 more minutes. The cycle repeats until session is over. What type of reinforcement schedule is demonstrated here? All right, after some more challenging questions, we get a pretty easy question. And that might be how your exam goes. You'll get a string of maybe challenging questions, and you'll get an easy question. When you get an easy question, you want to trust your preparation, answer it, and move on. In this case, we're looking at a reinforcement schedule. We know Luke is trying to determine the best schedule, and he is right now having the client work for 15 minutes and then giving a break. And so if reinforcement is based on time, is that going to be an interval or a ratio schedule? Well, that's going to be an interval schedule, right? Because we have interval and ratios. Ratios are responses, interval is time. Client has to work a certain amount of time. It's an interval schedule. So now we have to ask ourselves, is it changing or is it consistent? Well, the client after the break works 15 more minutes and the cycle repeats until session is over. So it's fixed. So the type of reinforcement schedule we're looking at here is what? A, non-contingent reinforcement. Well, it's not non-contingent, right? Because the client is required to do something to gain reinforcement. So it is contingent. What about B, fixed ratio? It is fixed, right? The cycle repeats, but it's not a ratio schedule. It's an interval schedule. C, variable interval. It is an interval schedule, but it is not variable. It is fixed. So it has to be D. The type of reinforcement schedule demonstrated here is D, fixed interval. You pull up to the Taco Bell drive-thru and prepare to place your order. However, no one greets you over the intercom. You say hello, and then 20 seconds later, someone says, "Can I take your order?" What does the 20 seconds most represent in the context of this question? Another easy question. Back-to-back easy questions. Trust our preparation. Answer it. Move on. In this case, we're looking at the 20 seconds, okay? We know you get to the drive-thru. No one greets you, so you say hello. 20 seconds pass. Someone says, "Can I take your order?" So we're looking at here, right? Time in between your hello and "Can I take your order?" So when you get to time in between an SD and the first response, what is that called? Well, that's latency. Inter-response time is time in between responses. This is our IRT. And so if you look at A, it's not going to be inter-response time because we're not looking at time in between someone responding. We're looking at the time it took for someone to respond to your first request or SD. So what we're looking at here is our latency. It isn't rate because we don't have a frequency, and it's not time sampling because we're not using any sort of discontinuous measurement here. We're measuring this one situation of how long it took someone to respond to you after you said hello. So we're looking at B, latency. All right, thanks for watching. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. Subscribe if you haven't already. We've got some great things coming ahead. You don't want to miss them. When you pass, let us know so we can include you in that Sunday shout out. Work hard, study hard. See you soon.